Hello and welcome to WellSpan Health. Thank you for taking the time to explore weight loss surgery with us. This video will help you learn about the weight loss surgery program at WellSpan. Today we will explore a variety of topics, including why you should choose WellSpan for your weight loss surgery, our diverse team of experts, obesity and the illnesses associated with this chronic disease. We will then shift gears and explain who qualifies for weight loss surgery, the surgical procedures our program offers, and navigating the program requirements. To end this session, we will review the next steps to move you forward in our program. If you haven't already done so, be sure to download the patient information booklet, which you can find at this URL. This booklet has valuable information and tools to help get you to surgery quickly and safely. Before we get started, let's hear from individuals who have had their bariatric surgery at WellSpan.
Before I had the surgery, I felt really run down. I had a bunch of joint pain, migraines, my body just ached all over. I had a lot of physical issues before the surgery. Mentally, I didn't feel good about myself. My self-esteem was very low. I was never comfortable being in public. I never wanted to be around crowds because I was always afraid of what other people thought of me. It'll be 11 months since I've had surgery, and I've lost a total of 86 pounds. I'm off a lot of my medications. My migraines have actually cut down a lot as well. I feel wonderful. I can keep up with my kids. I can rake the yard with all the leaves and not get tired, and I just feel amazing.
Over the years, I tried many different methods of weight loss. I tried just losing weight on my own by watching my diet. I counted points with Weight Watchers. I tried the weight loss pills, the Dexatrim, all that type of stuff, and nothing seemed to work. I would lose a couple pounds here or there, but as soon as you ate a normal meal and everything, you'd be back up to right where you were, if not higher. I had the surgery just over a year ago, and to date I've lost 103 pounds. I considered bariatric surgery just to make myself feel better. After reading everything that I thought it could fix or that it possibly could fix, I was impressed with the list. A lot of the things that I didn't even know it could change that I had issues with were on the list, and believe it or not, it did change a lot of that. I'm healthy as could be. I'm down from a size 18 to a size 4 in jeans, where I don't think I've seen a size 4 in my entire life. I'm healthier. I just feel so much better now. I'm so glad I did it.
The WellSpan Bariatric Surgery Program prides itself on high-quality care, patient safety, and convenience. Patients can choose to receive care at one of our 2 hospital locations, WellSpan Ephrata Community Hospital and WellSpan York Hospital, and receive care at any of our clinic locations in Gettysburg, Lebanon, Stevens, and York. We understand that you have a choice in weight loss surgery programs, and we are very honored you have chosen to consider the WellSpan program. We would like to take this opportunity to tell you about the unique features the WellSpan Bariatric Surgery Program offers. WellSpan is an accredited bariatric center with the American College of Surgeons and the American Society of Metabolic and Bariatric Surgery, also known as ASMBS. Accreditation ensures safety and quality throughout your experience with us. Our program is a full-service program that was developed around you. We offer comprehensive, individualized patient education, and our team is available to you whenever you may need us. Our surgeons are experts in their field and have performed weight loss surgery on thousands of patients over the years. Our surgeons and dedicated team will work with you to set goals and to choose the weight loss surgery that fits your lifestyle. Our surgeons believe in a team approach to your care. The surgeons at the WellSpan Bariatric Surgery Program are board certified and fellowship trained. Be sure to check out bariatric surgeon profiles on our website at wellspan.org/bariatrics. Each member of our bariatric team plays a vital role in your weight loss journey. Nurse navigators will work closely with you to help you understand and complete the specific testing that the surgeons and insurance companies require before weight loss surgery. Additionally, each bariatric surgery location has an advanced practice clinician, a clinical nurse coordinator, and a team of dedicated nurses working alongside the surgeon to support and guide you through your weight loss surgery journey. Registered dietitians will play an essential role in your success both before and after surgery. Dietitians specialized in weight loss surgery will provide you with nutrition education and guidance. Weight loss surgery is a life-changing surgery. WellSpan has a network of behavioral health specialists to help make sure you are not only physically ready for these changes, but that you are prepared emotionally. Additionally, WellSpan has a dedicated operating room team and patient floor designed specifically for bariatric surgery patients. You will receive the best level of care possible by the best team of weight loss surgery experts in South Central Pennsylvania. Obesity is an epidemic in the United States. According to the Centers for Disease Control, nearly 40% of U.S. adults and over 30% of Pennsylvanians are obese. On average, the medical costs of people who are obese have been shown to be $1,429 higher annually than those within a normal weight range. There are many illnesses that are associated with being overweight or obese, often referred to as comorbidities. You may suffer from some of the more common weight-related illnesses such as high blood pressure, diabetes, sleep apnea, or arthritis. The good news is, many of these illnesses are improved or resolved as a result of weight loss surgery. Improved sleep, less joint pain, and a better quality of life are all within your reach after weight loss surgery. To determine the severity of obesity, healthcare professionals use a tool called Body Mass Index, also known as BMI. BMI is a measure of a person's weight in relation to their height and is used to establish if a person qualifies for weight loss surgery. You can find a link to a BMI calculator on our website at wellspan.org/bariatrics. The qualifications for weight loss surgery vary based on the requirements of each patient's individual insurance company. However, all insurance companies agree that patients must meet certain BMI criteria set forth by the National Institutes of Health. As part of your bariatric surgery assessment at WellSpan, we will determine the best approach to help you meeting your weight loss goals based on your BMI. People with a BMI of 35 to 39.9 will qualify for surgery if they have at least one weight-related illness such as high blood pressure, diabetes, or joint pain. People with a BMI of 40 or higher qualify for weight loss surgery based on BMI alone and typically do not require additional weight-related illnesses for insurance approval. Those with a BMI between 30 to 40 also qualify for non-surgical weight loss procedures such as the Intragastric Balloon or endoscopic sleeve gastroplasty. Obesity is a complex disease with different surgical treatments to choose from. At WellSpan, we perform the Gastric Bypass, sleeve gastrectomy, and modified duodenal switch procedures, as well as revisional surgery for patients who have had weight loss surgery in the past and are experiencing some post-operative challenges. The WellSpan program also offers non-surgical procedures including the Intragastric Balloon and the endoscopic sleeve gastroplasty. In the next few slides, we will discuss the specific details of the different weight loss procedures we offer. Our surgeons will work with you to help you decide on a procedure that fits best with your weight loss goals. Let's take a closer look at each procedure to gain a full understanding of your options. With traditional open surgery, the surgeon uses a single large incision to enter the abdomen. The surgeons at WellSpan only choose this type of surgery in rare situations. This is because the large incision is associated with more pain, wound complications, scarring, and ultimately a longer recovery time after surgery. At WellSpan, the preferred surgical approach is the laparoscopic approach. Surgeons who perform the laparoscopic or minimally invasive surgery must receive intensive specialized training before they are able to offer this type of surgery. With laparoscopic surgery, several small incisions are made in the abdomen through which specialized surgical instruments and a video camera are inserted. The camera transmits a video from the abdomen to the monitors in the operating room. During the operation, the surgeon watches the video on the monitor and performs the surgery using the specialized instruments. This technique allows the surgeon to perform the same operation as the open surgery, but with smaller incisions, less pain, reduced risk of complications, and a quicker recovery. The last approach is what we call an endoscopic approach. This is a non-surgical approach where there are no incisions and the procedure is done entirely through the mouth. This means there is minimal pain and a reduced recovery time for the patient. The WellSpan Bariatric Surgery Program offers patients a variety of weight loss procedures which allow each patient to choose the procedure that fits their weight loss goals. The gastric bypass is the first operation we will discuss today. It is considered the gold standard of weight loss surgery and has been in existence for over 50 years. There are two parts to the gastric bypass procedure, the restrictive part of the operation and the malabsorptive part of the operation. The two parts work together to produce rapid weight loss after surgery. When performing the gastric bypass operation, a small stomach pouch, about the size of a golf ball, is created by dividing the top of the stomach from the rest of the stomach. This is the restrictive portion of the operation because the small stomach pouch restricts the amount of food patients can eat. The bypass portion of the stomach, or the large pouch, remains intact and working. It continues to produce stomach acids and digestive enzymes that will eventually mix with the food from the small pouch. Next, a portion of the small intestine is cut in half. The surgeon then takes the bottom end of the divided small intestine, brings it up, and connects it to the newly created small stomach pouch. Then, the remaining portion of the divided small intestine is reattached to the small intestine further down the intestinal tract. This is the malabsorptive portion of the operation because the surgeon is bypassing the part of the intestine that would normally absorb additional calories and nutrients. Altering how food travels through the digestive tract also causes changes in gut hormones that promote a feeling of decreased hunger. When a patient eats after a gastric bypass, the food enters the small pouch and then moves into the intestine. The brain then instructs the larger divided stomach pouch to make digestive juices. The food and digestive juices meet where the intestines meet, and digestion occurs. Most patients are in the hospital for 1 to 2 days after a gastric bypass and return to work in about 3 weeks. Like any surgery, there are advantages and disadvantages to each procedure. Since the gastric bypass has been performed for over 50 years, there's a tremendous amount of data proving its long-term effectiveness. Patients can plan on losing an average of 70% of their excess weight 1 year following surgery. Most of the weight loss occurs within the first 6 to 9 months after the procedure. This rapid weight loss results in a rapid reduction in weight-related illnesses, especially type 2 diabetes and reflux. Other benefits of the gastric bypass include a quick healing time, decreased absorption of calories, feeling full after eating less, and dumping syndrome. Dumping syndrome is a common side effect after gastric bypass surgery. Many, but not all, gastric bypass patients will experience dumping syndrome at some point after surgery. The occurrence of dumping syndrome is typically the result of poor food choices. Patients who ingest very sweet foods such as cake and candy or high-fat fried foods like gravy or French fries are at risk of having dumping syndrome. Symptoms of dumping syndrome mimic that of a 45-minute flu, including lightheadedness, a rapid heart rate, and a flushing sensation that may be accompanied by diarrhea. Dumping syndrome may sound like a disadvantage, but it prevents most patients from consuming the high-sugar, high-calorie trigger foods that may have caused the obesity in the first place. There are a few disadvantages to keep in mind with gastric bypass surgery. Because part of the stomach and small intestine are bypassed, vitamin supplementation is required daily for the rest of your life. Anti-inflammatory drugs like ibuprofen as well as smoking can cause life-threatening gastric ulcers. The sleeve gastrectomy is a purely restrictive operation for rapid weight loss. The procedure is done by forming the stomach into a long tubular sleeve. The remaining 75 to 80% of the stomach is removed completely. There is no rerouting of the intestinal tract with this procedure. The sleeve gastrectomy works in 2 ways. First, the creation of a sleeve restricts the amount of food the stomach can hold, reducing the amount of food and calories that can be eaten. Additionally, the removal of 75 to 80% of the stomach impacts gut hormones, which decreases hunger. When a patient eats food after a sleeve gastrectomy, food follows the normal route of digestion. The only difference with this procedure is that much of the stomach has been removed. Sleeve gastrectomy patients are in the hospital for 1 to 2 days after surgery and return to work in about 3 weeks. There are many advantages for patients choosing a sleeve gastrectomy for weight loss. Data shows that patients will experience a similar weight loss to those who choose the gastric bypass operation. Sleeve gastrectomy patients also experience rapid weight loss, averaging 60% of their excess weight at 1 year. Additional benefits include a quick healing time and the ability to eat only a small amount of food. There are a few disadvantages to keep in mind. Some patients have reported that their heartburn became worse after the sleeve gastrectomy. Also, the sleeve gastrectomy is not reversible because 75 to 80% of the stomach has been removed. Lastly, due to the removal of a large portion of the stomach, vitamin supplementation is required daily. The third procedure offered by the WellSpan surgeons is called the modified duodenal switch. Like the gastric bypass, there are 2 parts of the modified duodenal switch procedure: the restrictive part of the operation and the malabsorption part of the operation. The 2 parts work together to produce rapid weight loss after surgery. When performing the modified duodenal switch operation, a sleeve gastrectomy is created by forming the stomach into a long tubular sleeve. The remaining 75 to 80% of the stomach is removed and discarded. This is the restrictive portion of the operation because the small stomach pouch restricts the amount of food patients can eat. The malabsorption portion of the operation is similar to the gastric bypass. However, a larger part of the small intestine is bypassed, creating a greater degree of malabsorption. The modified duodenal switch procedure alters the gut hormones that result in patients feeling less hungry. When a patient eats after a modified duodenal switch procedure, the food enters the small sleeve and then moves directly into the bypassed intestine. Most patients are in the hospital for 1 to 2 days after a modified duodenal switch procedure and return to work in about 3 weeks. The advantage of choosing a modified duodenal switch procedure over the other procedures is that there is very significant weight loss due to the increased degree of malabsorption. This rapid weight loss is accompanied by a rapid reduction in weight-related illnesses, especially type 2 diabetes. The modified duodenal switch procedure is not for everyone. Patients must take vitamins and mineral supplements for the rest of their lives. Some patients also experience gas, flatulence, and loose stools, all of which can be medically managed. Some insurance companies will not cover the modified duodenal switch procedure. This is because the long-term data on its effectiveness is not as plentiful as with the other procedures. If you had weight loss surgery in the past and are now having issues like weight gain or abdominal pain, a revision may be an option for you. Revision surgery is different for each patient. For this reason, each patient will meet with a well-spanned surgeon to undergo testing to determine which revision surgery may be best. The Intragastric Balloon is a new and innovative non-surgical outpatient weight loss procedure available to a specific group of patients with a BMI between 30 and 40. The endoscopic procedure is performed by inserting a deflated balloon through the mouth into the stomach and filling it with sterile water. The balloon is left in the stomach for 6 months, and during that time it restricts the amount of food that can be eaten. After 6 months, the balloon is removed and the patient will continue to eat healthy foods and exercise to keep the weight off. Another balloon can be inserted after the first balloon is removed to continue the weight loss. Insurance companies do not cover the cost of the intragastric balloon, but a reasonable package price is available. After an intragastric balloon placement, patients will be nauseous and may even vomit. The balloon is doing its job restricting food intake. Weight loss with the balloon will be much slower than the surgical options. The endoscopic sleeve gastroplasty is also a newer weight loss procedure available to a specific group of patients with a BMI greater than 30. Not to be confused with the sleeve gastrectomy, this procedure is done using an endoscope that is placed into the mouth and advanced down into the stomach. The endoscope places small stitches in a specific pattern, resulting in a sleeve-like shape of the stomach. The stitches reduce the size of the stomach, limiting the amount of food that can be eaten. Insurance companies typically do not cover the cost of the endoscopic sleeve gastroplasty, but a reasonable package price is available. There are many advantages to the endoscopic sleeve gastroplasty. First, it is done endoscopically, so typically patients could go home the same day. There are also no permanent changes to the anatomy, so malabsorption is not an issue. The endoscopic sleeve gastroplasty has shown to improve weight-related illnesses and make it difficult to overeat. Some patients may experience postoperative nausea or reflux, but this is often easily managed by medication. There's no surgery that is without risk. Although serious complications after weight loss surgery are rare, they do happen occasionally. Some of the more common complications include nausea, vomiting, and dehydration. These can be caused by inadequate food or liquid intake and can be remedied by a variety of methods depending on the severity. Infections, ulcers, internal bleeding, and bowel obstruction can all occur but are very rare. The rarest but most serious complications after weight loss surgery are blood clots and leaks. Both are manageable complications if caught early. For this reason, all patients of the WellSpan Bariatric Program are encouraged to contact the program right away if something doesn't feel right after surgery. Research shows that weight loss surgery improves the quality of life. In addition to significant weight loss, studies have found that patients who had weight loss surgery have a lower risk of dying prematurely than obese individuals who did not have weight loss surgery. This reduced risk of premature death is due in part to the rapid improvement of diseases that are caused by obesity. These illnesses may include high blood pressure, sleep apnea, arthritis, high cholesterol, reflux disease, fatty liver disease, and diabetes. Research has also found that weight loss surgery will decrease the risk of certain cancers, including esophageal, breast, and colon cancer. In addition to improvements in health and longevity, weight loss improves overall quality of life. Mobility, self-esteem, ability to work, and social interactions are often the reasons patients cite as reasons for their improved quality of life. Losing weight quickly sounds exciting. However, you must remember that obesity is a chronic condition. Weight loss surgery is not a cure for obesity. It is only a tool to help keep the weight off. If the tool is not used properly, weight regain can occur. This is seen when patients return to old habits like eating high-calorie foods and excessive snacking. Only you can maximize your success after weight loss surgery. The journey to weight loss surgery presents you with many options. That is why the WellSpan Bariatric Program will assign a nurse navigator to help guide you through the process. Your nurse navigator will contact your insurance company to determine if weight loss surgery is a covered benefit. Additionally, your nurse navigator will work closely with you to set up appointments and collect the documentation required for insurance approval. The time it takes each person to get to surgery varies due to insurance requirements and your personal medical history. However, your WellSpan team works to get you to surgery as quickly and safely as possible. Getting to surgery safely means completing certain requirements prior to your surgery. Each patient will meet individually with a WellSpan surgeon to discuss all weight loss procedures in detail. The surgeon will also order additional testing or specialist consultations based on your medical history. Lastly, if your insurance company requires medically supervised weight loss, our WellSpan team has a program in place to help you complete this requirement easily. Medically supervised weight loss means that your insurance company requires that you participate in a weight loss program that is supervised by a physician. Not all insurance companies require medically supervised weight loss, but if yours does, our nurse navigators will help you to determine how many visits are required before surgery. The medically supervised weight loss requirement can be completed through your own personal physician, or it can be completed free of charge at one of our convenient WellSpan locations. Paying for surgery doesn't have to be confusing. Because every insurance company is different, our nurse navigators will help you understand your individual insurance policy, its associated co-payments, and out-of-pocket maximums. For patients who choose to pay for the entire procedure out of pocket, WellSpan offers reasonable pricing as well as a specialty program that offers you financial protection for any costs that may arise from surgical complications. Thank you for listening today, and congratulations on taking the first step toward a healthier life. To request a consultation, visit www.wellspan.org/bariatrics and fill out the form. Our office will review the information and contact you to schedule your first appointment. Visit www.wellspan.org/bariatrics to download the patient information booklet. It has all the information that you need to get started. We look forward to accompanying you along your weight loss journey. Thank you for taking the time to learn more about the WellSpan Bariatrics program. When you are ready to take the next step, we look forward to helping you meet your weight loss goals and improve the quality of your life.